Welcome to the GI Nutrition Show. I'm Amy McRae, registered dietitian and CEO of Grounded Root Nutrition. Today's topic is how do I know if I have celiac disease? Well, let's first start with what is celiac disease. It is an autoimmune condition where your body will recognize that gluten, which is a protein found in wheat, rye, and barley, as foreign, and it's going to mount an attack. This attack then damages the lining of the small intestines, resulting in poor nutrient absorption, anemia, diarrhea, and a whole host of symptoms. So our small intestine has these finger-like projections called villi, and in normal people, these are full length, much like your fingers. So the entire length of these finger-like projections are where your body absorbs nutrients. In someone affected by celiac, the tops are missing, making these villi very short. So let's demonstrate this with your hand. If you open your hand up in front of you, this is your normal intestinal villi. Now, if we bend our fingers at our middle knuckle, this is how short the villi are in celiac disease. These tops are blunted. As you can see, there's way less surface area to absorb nutrients. Now, celiac disease is genetic in nature, which means that you must have the genes in order to develop celiac. So to date, the genes that are referenced are HLA DQ 2.5 and HLA DQ 8. However, just because you have these genes does not mean that you have it. It's estimated that 30 to 40% of the population has one or more genetic markers, but only 1% develop the disease. This is about 1 out of every 133 Americans. It is also estimated that 83% of patients with active celiac disease are either misdiagnosed or undiagnosed. So really only 17% of the population knows that they have celiac disease in an active state. So who goes on to develop celiac disease? Unfortunately, there's still no definitive method to determine this. Research suggests that it's triggered by some sort of life stressor. So trauma, illness, childbirth, puberty. I saw quite a few patients that got triggered during COVID. So any type of stressor. Part of my intake is to ask you about your birth and infancy. I want to know antibiotic use history as well, as these all play a factor in the development of your gut microbiome. What I do see is that the stronger your gut microbiome, the more protection you have against the expression of celiac disease. And let me say, celiac disease does not care about your age. It can be developed young or old or anywhere in between. It is a full spectrum of diagnosis. Those that have family members with active celiac disease are at higher risk of developing it themselves. Now, currently, the only treatment for celiac disease is adhering to a gluten-free diet. There's not any type of medication out there to treat or cure celiac, and there really isn't anything that's going to break that gluten down to a safe amount so that your body doesn't mount an attack. There's a lot of products out there called gluten ease that can help you in the event that you were to get an accidental exposure, but it can't be used to prevent that celiac reaction. So now that we know what celiac is, let's talk about the symptoms associated with celiac disease. According to beyondceliac.org, there are 200 to 300 symptoms of celiac. Now, I'm going to list the most commonly occurring symptoms in alphabetical order, and this is according to beyondceliac.org, and I do see a direct correlation with my patients with these symptoms as well. So anemia, which is low iron in your blood. We've got anxiety, arthritis and joint pain, and this is often related to the inflammation that happens because of celiac. Brain fog is a really, really big one. So you might feel a little spaced out or unable to concentrate no matter how hard you try. Again, that's a symptom of celiac. Bloating, constipation, diarrhea, and gas, all associated with celiac. Depression, can have discolored teeth, so white, yellow, or brown spots on your teeth. Fatigue, chronic fatigue and tiredness can definitely be a symptom of celiac, as can those headaches and migraines. In women, you might be experiencing infertility. There also comes a bit of irritability, so being impatient or grumpy, outbursts or temper tantrums in kids can be a symptom. An itchy skin rash, mouth sores, so think of those like canker sores, osteopenia and osteoporosis, any type of tingling, numbness, and neuropathy, as well as vomiting. So if you're experiencing any of these symptoms, I'm going to encourage you to go to a doctor. It can be a primary care or a specialty GI doctor called a gastroenterologist. But the first step for you in getting a diagnosis is to continue eating gluten. Why, you might ask, if gluten is the cause of the problem to begin with? Well, the testing is going to require that your body is actively mounting an attack for that attack to be detected. So the recommendation is to eat the equivalent of 2 to 4 slices of bread, it can be white or wheat, per day until your testing is complete. Again, we need your body to be actively mounting an attack for accurate diagnosis. The first step in the process is generally blood work, and this can be done by your primary care doctor or a GI doctor. They're going to order a comprehensive panel, and the panel is going to include a total IgA, so we need to know that your body is actually making something called IgA, because if your body's not, some of these other tests can be a false negative. We also want to know a tissue transglutamase antibodies. We're going to run those in IgA and IgG. Deaminated gliadin peptide antibodies, also run in both IgA and IgG. And then endomysial antibodies, and this one is only an IgA test. So usually patients, if they start with their primary care doctor, if this blood work comes back and indicates a positive for celiac, you'll then be sent to a GI doctor. The next part of the sequence is getting an upper endoscopy with a biopsy. So they're going to put a little scope down your throat and they're going to check out your stomach, then that goes into your small intestines. Sometimes the doctors can see with the naked eye that your intestines are blunted, and sometimes we require a biopsy. Either way, they're going to do biopsy for confirmation, and this is considered the gold standard for diagnosis of celiac in the United States. Now, there are also some other diagnoses that can cause reactions to gluten. You could have a wheat allergy, so this is an actual allergy itself to wheat. You could have a thyroid condition, so your body might recognize gluten as being a similar molecule to the tissue in your thyroid, and this causes that type of a gluten reaction. There's something called dermatitis herpetiformis, which is actually a skin rash. It's kind of blistery in nature, and it is a form of celiac disease. And then there is also non-celiac gluten sensitivity. This could be something related to being sensitive to FODMAPs, or beginning stages of another autoimmune condition, or just a general sensitivity to gluten. There is also something called silent or asymptomatic celiac disease, and this is generally detected when people do preventative screening for celiac. So if I have patients with family members that have active celiac, I will generally recommend blood work screening every 2 years just to stay on top of it. The earlier we detect celiac disease, the less damage in your intestines and the less depletion of nutrients that you have. Now, once testing is complete, I want you to ask your doctor when it's safe to resume gluten. Now, you might be wondering, what do I do if the results come back and I have celiac? Stay tuned next week, and we will discuss what to do once you receive a new diagnosis of celiac disease. I hope you enjoyed today's show. Please visit my website, groundedrootnutrition.com, to learn more about how I can become a partner in your health journey, or contact me directly at hello@groundedrootnutrition.com. Have a wonderful day, and I'll see you again soon.